CNA and welcome to Tide's Online Tutoring Academy. We're going through the CNA course. We're doing a read-through and we're just going to dive right in. We can follow previous videos, so we're just going to get into the topic of bowel elimination, and our plan is to wrap up this section of the skill base, which is under the activities of daily living category. Okay, so we're just going to dive right in. Thanks again for watching. Okay, bowel elimination. Fecal impaction. Fecal impaction occurs when a patient has had long-term constipation. Notify the nurse if the patient has no stool, loose stool, abdominal pain, or distension. The nurse may do a digital rectal exam to check for an impaction. The doctor may order laxatives, suppositories, or an enema to encourage bowel elimination. The nurse may remove the impaction, or they may ask the nurse aide to remove it. To remove the impaction, place the patient in Sims position. Insert a lubricated, gloved finger into the rectum, massage around the ardent feces, and gently pull out a small amount out. Removing impacted feces in the rectum can be dangerous. It may stimulate the vagus nerve, causing causing bleeding, perforation, or bleeding. Stop the procedure and report to the nurse if the patient bleeds, has an irregular pulse, loses consciousness, or experiences pain. Enemas. Enemas are liquids that stimulate the movement of bowels. The type of fluid used is determined by the physician. Nurses may administer enemas containing medication. Enemas are administered with the patient in the Sims position. The lubricated tip of the enema tube is inserted into the rectum and the fluid is closely drained into the rectum. After an enema, the nurse aide should be prepared to provide the patient with a bedpan or a commode, or to move them to the toilet so they can defecate. Ostomies. Ostomies are openings that allow drainage from organs, such as your bladder or your intestine, outside the body. The opening of the skin surface is called a stoma. Ostomies typically empties into a ostomy bag that can be opened at the bottom to be drained into the toilet. The ostomy bag is changed every 2 to 7 days. Helpful tips. Suppositories are medicated lubricants in the rectum. Because they are medications, suppositories are inserted by nurse. However, the nurse aide may be asked to assist. Okay, number 12 question. After a patient receives an enema, the nurse aide should be prepared to, I repeat, after the nurse aide receives an enema, after a patient receives an enema, the nurse aide should be prepared to A. Keep the patient NPO for 8 hours. B. Place the patient in the Fowler's position. C. Provide the patient with a meal tray. Or D, assist the patient with bowel elimination? And the answer is D. After receiving an enema, a patient will need to defecate. The nurse should be prepared to assist the patient with a bedpan or commode, or to move them to the toilet. So once they get an enema, you should assist the patient with bowel elimination. Okay, we're moving now on to patient comfort and safety. The nurse aide has a duty to help patients feel safe and comfortable. When performing tasks with patients, the nurse aide should always prioritize these needs. Patients may also tell the nurse aide when they are uncomfortable and or have unmet needs. The nurse aide should meet these requests when able and should report complaints of pain or inadequate care to the nurse. Some other guidelines for promoting patient safety and comfort are below. We should defer to the patients regarding any personal preference or ritual. We should position the patient properly. We should keep the patient's clothes and the bed linens clean and wrinkle-free. We should adjust the patient's room temperature, lighting levels per the patient's request. Another way to keep the patient comfortable is to organize the patient's care tasks so the patient's sleep is uninterrupted. We provide a clean, dark environment for sleep. We use a gentle touch or a soft voice when preparing care. We avoid sudden movements or sudden noise, and we facilitate the patient with supportive family. On to our next question. A patient who is having his vitals checked every 4 hours complains to the nurse aide that he cannot get enough sleep. How should the nurse aide respond? So a client who is having their vitals checked every 4 hours complains that they're not getting enough sleep. How should the nurse aide respond? A, everyone has to have their vitals taken at night. B, I am sorry you're not getting enough sleep. I will ask the nurse about changing your schedule. C, sleep is very important. I will stop taking your vitals at night and instead come in the morning. D, I am sorry, but I cannot change your schedule. Maybe you can take a nap during the day. And the answer is B. The nurse aide should show sympathy to the patient. The nurse aide cannot change the patient's schedule on their own, but they can offer to speak to the nurse about it. So you should say, I'm sorry, you're not getting enough sleep. I will speak to the nurse about changing your schedule. Okay, so we'll go to fall and prevention. Falls are the most common cause of injury in the medical care. Fall risk is increased by many different factors, including increased age and certain medical conditions. Follow general risk guidelines for all patients regardless of risk. We should keep the floor clear of clutter. We're dealing with fall prevention. We should ensure the patient's basic needs are met. They are hydrated and they can eliminate as needed. We should place call light and equipment within the patient's reach. So equipment such as the eyeglasses and the canes. We should respond to call lights and alarm promptly. We should use side rails and wheel locks on beds and stretcher. We should keep the patient's bed in the appropriate position. We should use the necessary staff and equipment for providing care. Ensure the patients wear a non-slip footwear and do a safety check of the patient's room after visitors leave. Our next question. All of the following responsibilities of the nurse aide relates to fall fall prevention except A, picking up clutter from the room, B, putting up side rails after transferring a patient to the bed, C, monitoring a patient's sedation level, D, providing non-slip footwear for the patient. And the answer is C. This is the exception. The patient's sedation level will be monitored by a nurse, so this has nothing to do with fall prevention. Okay, we continue. Lifting, transferring, and positioning patients. The nurse aide needs to know how to safely move and position patients in the bed and how to transfer patients to and from the bed. Always follow general safety guidelines for lifting and transferring patients, regardless of the patient's functional status. So, 1. Knowing the procedure, the equipment, and the number of staff needed for the move or transfer before starting. So we have the slide board or mechanical lift or a transfer belt. So you know the equipment that's needed and how many staff is required. Next, we promote patients' participation when appropriate. It provides the patients with a sense of autonomy and minimize the strain on the caregiver's body. Always bend at knees, not at the waist when lifting. Stop the move or transfer and return the patients to the original position if they report pain. We use a predetermined signal, example on the count of 3, to start the lift. We keep the patient's body in a comfortable and correctly aligned position when moving or transferring. Always lock the wheels on the bed, the stretchers, and the wheelchairs when moving or transferring patients. Use the appropriate position device to promote comfort and prevent injury. Example, pressure ulcers. Okay, a useful hint. Always use the lift procedure and equipment outlined in the care plan. If the appropriate equipment is not available, alert the nurse. Okay, so we have some evaluation skills that we're going to run through very quickly. Skill evaluation. Assist a amputate using a transfer belt. 1, which is very important, is highlighted. It says ensure client is wearing non-skid footwear. 2, lower bed to a safe level and lock wheels. 3, assist patient into a sitting position with feet flat on the floor. 4, and that's 3 was very important. Say assist patient into a sitting position with their feet flat on the floor. 4, apply transfer belt securely over the clothing. 6, explain procedure to the patient and agree on a signal to start standing. 6, stand facing the patient's knee to knee, toe to toe, when with an upward grasp on the transfer belt at the patient's side. 7, direct patient to stand using a agreed upon signal. 8, assist patient to stand. 9, walk behind and slightly to the side of the patient for at least 10 feet. 10, assist patient back into the bed and remove the belt, and finally wash your hands. Okay, we're going into another skill evaluation, which is transfer from bed to wheelchair using the transfer belt. Okay, so that first one, Okay, so yes, this is from now the bed to a wheelchair using the transfer belt. 1. Position the wheelchair alongside the bed facing the head or the foot of the bed. 2. Fold up or remove the footrest of the wheelchair. 3, which is important, lock the wheelchair wheels. 4. Lower the bed to a safe level and lock the bed wheels. 5, which is important, assist patient into a sitting position with the feet flat on the floor. 6, ensure patient is wearing non-slip shoes. 7, fasten the transfer belt at patient's waist over their clothes. 8, explain the procedure to the patient and agree on a signal before standing. 9, stand facing the patient, toe to toe, knee to knee, with an upright grasp on the transfer belt at the patient's side. 10, direct the patient to stand using an agreed upon signal. 11, help the client position themselves in front of the wheelchair with the back of the legs against the wheelchair. 12, help patients sit down with hips against the back of the wheelchair. 13, remove the transfer belt. Then 14, reapply the footrest and position patient. And finally, wash your hands. We're almost there for this video. Coming to an end. Okay, skill assessment. We know is on position on your side. Position the patient on the side. 1, we lower the head of the bed. 2, we raise the rail on the side of the bed the patient will turn towards. 3, ask the patient to reach for the side rail if able when assisting them to slowly roll on their side. 4, place the pillow under the patient's head. 5, reposition patient's shoulder and arm so that the patient is not lying on their arm. And 6, place the pillow behind the patient's back. 7, bend the patient's knee and place the pillow between their legs and under their knees and angle for support. 8, wash your hands. Review question. If a patient complains of pain when being transferred from a bed to a wheelchair, the nurse aide should A, tell the patient they will document the pain in the patient's chart. B, ignore the patient's complaint and continue to transfer. C, immediately stop the transfer and return the patient to the bed. D, try to complete the transfer using a different procedure. The answer is C. Moves and transfer should be stopped for any new complaints of pain. In addition, the nurse should be notified so modifications can be made to the care plan. Okay, now we're going into range of motion exercises. Range of motion exercises are the movements of extremities through the full range of their natural motion without causing pain. Range of motion exercises strengthen the muscles and prevent muscle degradation caused by lack of movement. Active range of motion exercises can be done by the patient alone. During passive range of motion exercise, the nurse aide moves the limb through the ROM with little or no help from the patient. General guidelines of range of motion exercise are given below. Move the patient's limbs slowly, gently at joints to prevent injury. Only move as far as the patient is able to do comfortably. Support the limbs at the joints, such as the elbow or the wrist, knees, or ankles of legs. And range of motion exercises should never be forced. If the patient expresses pain or discomfort, stop exercise immediately. Skill assessment: performing a modified passive range of motion for one knee and one ankle. So we start by 1, place the patient in a supine position. 2, ask patient to voice complaints of pain. 3, support the leg, which is highlighted. So support leg at knee, ankle. Gently bend and straighten the patient's leg at the knee 3 times. Stop exercises if the patient complains of pain. 4, lift the patient's foot a few inches off the bed. Support their ankle and push-pull their feet 3 times. Stop exercise if the patient complains of pain. And 5, wash your hands. Next, and this is the last part before we close off this portion of the section. We're dealing with the skill evaluation, performing modified passive range of motion for one shoulder. So instruct the patient to voice complaints of pain. 2, support the arm at the elbow or the wrist. Gently lift straight the arm up towards the patient's head and until it's a level with their ears. Repeat it 3 times. Stop exercising if there is pain. So you lift it. 2, 3, support the arm at the elbow or wrist. Gently lift the arm away from the patient's body until it reaches the shoulder level. So we're going this way. Repeat it 3 times if the patient stop if the patient complains of pain, and 4, wash your hands. Okay, our final review question for this section. It says, when performing passive range of motion exercises for the knee, the patient should be A, supine, B, prone, C, sitting on the edge of the bed, or D, standing next to a chair. And the answer is A, they should be in a supine position. So they say passive range of motion exercises for the knee are done when the patient supine in the bed. Okay, thank you so much. We'll be going to our next section. Thank you for that. We make it through these skill set as it relates to the first portion of the skill set, which is dealing with daily activities of daily living. Thank you and see you soon.